Welcome to the Igniting Impact podcast, brought to you by Public Knowledge. I'm Stacey Moss, the host of the podcast and the president of our management consulting firm. Our firm's vision is to be a catalyst for change, leaving each person, project, client, colleague, and community better than when we started. The Igniting Impact podcast is an opportunity to share with you what our clients do daily to impact our world. We want to highlight this essential work and the work that they do for their customers, clients, and stakeholders that is changing lives despite the many daily challenges that they face. On today's episode, we have two guests with us, Shelley McCann and Jeralyn Grow. They are here today to talk about Montana's MPATH project. So let's start by getting to know you all a bit more. If you'd share with us, just tell us a little bit about yourself, what you do for work right now, and how you got there. And either of you can begin.
Well, I'm Shelley McCann. I am the Medicaid Enterprise Systems Administrator for the Department of Public Health and Human Services in Montana. And how I landed where I am today, I originally started out as a provider in Montana and working in people's homes, making sure that they had just really activities of daily living and the right supports they needed to stay in their home. And then in about 2007, I made a transition just sort of after I had implemented a program for individuals with traumatic brain injuries that was very successful. And as well as it was actually completely charity funded home that was for individuals with developmental disabilities. And it was really a respite home, right? So that people could, parents of folks who had, children, they could call us up and schedule a time where they could maybe leave for a week or something like that and go on vacation. So after I had done all of that, I decided, I need to transition and I need to do something else. And so I actually started on the contractor side. I worked for an agency that was supported as fiscal agent for the state of Montana, Montana Medicaid program. And from there, I just learned so much about the other side of, I had a lot of service in my history. And so this is the other side of service, enabling service, really. And so just really transitioned from working for the fiscal agent to supporting the DDI project for the new system that we were going to implement at Enterprise. And that project ultimately didn't end up being fully implemented. We implemented a pharmacy solution from that. And then I transitioned to the state. I started as an analyst on our DDI project. And from there, became a project manager. And then during COVID, our executive leader, the person who was in my position prior to, transitioned over to the eligibility side. And so I really had been around the team and working with the team and believed so strongly in what it is we do. And that's how I ended up here today.
Okay, great. Okay, Jeralyn, do you want to tell us a bit about yourself?
Sure. My name is Jeralyn Grow. I work for Public Knowledge. I've been here for actually 15 years this year. And I have worked with Montana DPHHS for most of those 15 years on and off. Actually, my first project was with their integrated eligibility system, writing the RFP for something that's been implemented for probably a decade by now. And I have been working on the MPATH project in various roles, doing IB&V, and I have been the IB&V project manager since 2017.
And what'd you do before Public Knowledge?
I actually came to Public Knowledge not long after I finished grad school, getting a master's of public administration. And it really just happened that I met someone that worked at PK who said, "Oh, well, we're hiring. You should apply." And I had never left. So
that's great.
Yeah.
Okay, well, let's get to know you both on a more personal level. If you tell us a bit about who you are outside of work and what values you live by.
So I am a mom of 3 and truly really enjoy where we live in Montana. My values are really based off of my family and really wanting to make sure to see them be successful in whatever it is that they're going to end up doing eventually. And then service to our community, service to our families.
That's great. And what do you do with those 3 kids outside of work? Are they in sports activities?
So my oldest son just recently got married and moved away to Florida, and he is successfully running his own business there. And my other 2 are very active in scouting. And then my daughter also does dance and that kind of thing.
Jeralyn, tell us more about yourself outside of work.
Well, I live in Idaho, but I do a lot of work in Montana, and my family, my mom and my sister both still live up there. So I get to kind of go back and forth quite a bit. And outside of work, I am really involved in a dance fitness group. And it's a lot of fun.
It's been so much fun to watch, actually. Good. And what is it about that you enjoy?
Well, I think just in general, community is just something that has been important to me and how I was raised. My grandparents were farmers. And when you're a farmer and you live out in the country, you really need to depend on people. So they really instilled that in me, taking care of people and being kind.
Okay. And are those the values that you live by?
I certainly try to. And I went to school to do my MPA thinking that I would run a nonprofit, but I kind of learned that's really lonely work. They're usually very small teams, and sometimes the person that runs the nonprofit might be the only employee. So I was really happy to come to PK and to be able to work with people and not have to take on everything myself.
That's definitely my experience coming from law to PK.
Yeah.
So that's interesting. That was exactly the way I felt. It was so lonely and I wanted a team around me. So that's great. All right. Well, let's get to know the project a little bit today. So we're here to talk about the MPATH project. Do you want to tell us a little bit about what it is and what the goal of the project is?
MPATH stands for Montana's Program for Automating and Transforming Healthcare. And that truly is almost really, you could consider it our mission statement, looking to transform healthcare into really IT is simply a communication vessel, really, that enables physicians, members, folks easier access to healthcare in and of itself, and then their healthcare information to make informed decisions. So we actually transitioned from a previous modernization initiative for our Medicaid systems at the end of 2015. That was right around the same exact time that CMS was saying, you know what, no longer are we going to support Big Bang implementations. We really want states to have focused, successful module implementations. And we really were we were just staged perfectly to just dive right into that. So my predecessors actually worked really closely with our executive stakeholders to really outline kind of what our strategy needed to be, what modules did we need to procure and in what order. And we have been executing against really that very similar vision that was rolled out in 2016.
That's great. And so how many modules have you, how far in are you on that plan?
We are 7 modules in. Actually, we'll be implementing our 7th module, our electronic visit verification component. We'll be implementing that in September. But we have really implemented, I would say, our foundational information, right? We knew our strategy needed to really make sure that we had a foundation before we started deconstructing really our Medicaid Management Information System, the MMIS. And so we have implemented an integration platform. We have implemented a provider enrollment maintenance solution and our data analytics, right? So that's really sort of our foundational platform. And now we are actively in early DDI for our claims solution and looking to kick off fraud, waste, and abuse here in the very near future.
That's great. So how many modules are left? Is fraud, waste, and abuse the last one, or?
No, we actually envision that we will have all of our modules replaced by the end of 2026. So earlier on, I had mentioned that we implemented a pharmacy system. That was truly our first system. We really sort of just said, you know what, it's a module.
It's easy to peel off too. Yeah,
exactly. And so we implemented that, but now we are at the end of that contract life. And so that'll be one of the last things we procure is a new pharmacy solution.
That's great. All right, Jeralyn, you want to tell us a little bit about Public Knowledge's involvement and role on the MPATH project?
Yeah, we are the IVV, which is Independent Verification and Validation. So we come in to give a sort of a third-party optic of what's going on the project. And we also kind of just work with the state to see what kinds of supports they need. It's actually been a pretty adaptable role, and we work closely with the state to figure out where we're providing the most value within any constraints from the federal agency about what our role might be. So we've been doing that for quite some time. So even that pharmacy system, we're around for the certification of that. And then Shelley and her team did the planning for what the next modules would be. And it's funny because when she tells you how many modules there are, the number, like, it changes because
of how you split it.
In the end, like at the very beginning, I think the very first module that went live wasn't even one of the planned modules. It was premium billing and collections. And it had to do with, they call it HELP in Montana, but Medicaid expansion. And the state just got in there and was like, how are we going to do this as quickly as possible to meet this deadline? And so the first module that got live wasn't even one of the ones they had been listing and counting. So I do expect that's just how it's going to be. There's always new things that come up before you finish the full scope of all the systems that you want to get out there.
I think all the states are kind of figuring that out, right? As you do get away from that big system implementation, you're kind of always in that process of, designing what the vision's going to be, what's the new module that you need, what's the need, dealing with the procurement, dealing with the implementation, and then on to the next. So do you see kind of an end and then a beginning, or do you see it kind of continual in the future?
I see it as continual and not necessarily as clearly outlined as now we need a new pharmacy system. But really, the federal guidance as well as the state's need does evolve. And so we, what has been probably our priority even last year is shifted a little bit. We were looking to procure and implement a third-party liability solution. And now we're moving into, actually, we need to focus on fraud, waste, and abuse and really make sure that we are evaluating our data and using our data to ensure that, we're being responsible with the state's money.
That's great. Tell us a little bit about who's involved on the project or on the team. Like what types of people, what types of stakeholders are you dealing with day to day?
So my direct team is comprised of business analysts and project managers. And then really we have sort of a seamless contractor who really supports from a technical integration and overseeing, module design, development, and implementation. So we have a set of contract project managers and a program manager to really help drive that, as well as we really have relied very heavily on our public knowledge team to make sure that just procurements make sense, requirements make sense, et cetera. So I would say that's really our direct service team. And then we have, I would say, probably at any given time, about 30 different program stakeholders. These are stakeholders that deal regularly with providers or members, and they need to implement a new something for their program, or they need to change something for their program. And so we regularly receive sort of inputs with them and work really in concert with them to make sure that maybe we have to implement something in our legacy system, but it also is orchestrated into the rest of our enterprise for like downstream reporting, et cetera. And then we do have really I would say more than ever, and outstandingly engaged. It's actually extremely exciting because from our director of the department all the way through our CIO and our Medicaid director, right? They are all very involved where I can pick up the phone and call them and say, hey, this is going on, or hey, here's something that I want you to be aware of, or we need a decision on this. And that turnaround has been, and the support has been phenomenal.
That's rare and also so necessary to have successful implementations and successful projects. So I'm really glad to hear that.
I absolutely agree. And, from 4 years ago to today, it is, just very, very different. The landscape has evolved so much.
So dealing with like 30 plus program team members, how do you manage that? How do you engage them or communicate with them? Because that's a lot of people.
So I don't do it alone.
Yeah.
I have my project managers are usually the sort of the first line of, this individual has reached out and asked me about this. How can we support this? And so then there's really a sort of an orchestrated working with the entire team to make sure that we understand how this change might impact all of our modules. And then working with them to understand the use cases and downstream reporting needs and all of that jazz. So I think I don't do it alone.
Yeah.
I have a phenomenal team that supports that communication.
That's great. Jeralyn, who's on the team on our side, kind of what types of roles do we have involved, and how involved are you with other stakeholders, like potentially CMS or other outside stakeholders?
Well, for our IB&V team, it's evolved over the years as the number of modules has changed. So we have actually recently done a little bit of reorganization. I now have 2 deputy project managers because it was just getting to be too many modules for me to just have all that information in my brain all at once. Shelley still has it all in her brain, but it was more than I could handle. So we've divvied up those modules between those 2 individuals and myself. And then we have a team of analysts who support us through all of that, doing deliverable reviews, attending the meetings, and helping us write up our reports, risks and issues, and the document of record, which is where we keep all the contract language current so that there's a single source of information for them to go to. So I definitely could not do all of that by myself or even just with a few people. So we have gotten a bigger team, and then we bring in some experts on certain topics as needed. Like right now we're using someone for certification. We have a communications SME. And so we really just bring in the right person at the right time to do these specialized roles when we need to. And then we don't directly engage with any of the state's stakeholders. We might, participate in some meetings and things with the state, but we don't do anything on their behalf in that realm. And with CMS, we mostly also go through Shelley to get the most current information, and then we interact with them when we're doing system certifications, which we got one coming up in a couple weeks.
Goodness. That's great. All right. Well, what is the need that this system is filling? Like, why MPATH? Why this technology project? And especially for those that don't understand what MMIS systems are, what's the need that it fits into?
Medicaid is the largest payer in the state of Montana. We support about 320,000 people. So that's my neighbors. Those are friends. They are people even sometimes that we work with. And so it starts with the members, 320,000 members. And then we have about 33,000 providers that we also support, enroll, and pay claims for. And so if you always keep that into perspective, these are our people, and we need these providers to support these people. So that is absolutely sort of the foundation of what we're doing. And so technology is needed to make sure that the folks who need services, that providers are enrolled and they're eligible for enrollment. And they're eligible to provide those services and those types of services. So you need a system to be able to manage and monitor that. And then you need another system to make sure that we're paying claims, but we're paying only eligible claims. And then we're very federally supported, right? So once we're certified, it's really a 75-25 split. And so we have to make sure that our reporting is spot on. And in order to do that, you need to be able to collect the right information and then put it in a format that they need in order to interpret it. So I would say if you start with the folks that we're serving and then evolve that over to the systems we're implementing, it's really just to make sure all of the funding continues so we can continue to do our work.
I'd say you're a rare technology person that you focused on the people first and then explained how the system supports it. And I love how you described it because I think that really resonates with people, right? Is how does the technology support what we're really here to do and what the program's here to do? And I think that's a great reminder of the why behind, because they're expensive systems and they're complicated, but it's such a integral need. So. Anything to add, Jeralyn, about the why MPATH?
Well, I mean, Shelley talked about the reason and why we need a system, but MPATH is also about replacing some really old technology. And Shelley could probably tell you more about what that looks like, having worked on the fiscal agent side, but it's old and it's not flexible and it can't adapt the way we need it to with how quickly policies change and technology changes. So it needs to replace that, and that's what the modular approach does, is it breaks it up into smaller pieces that are more manageable.
What are the other reasons behind going modular? You talked about it being more manageable, but what are the other reasons?
I wish that it could say it removes all risk from implementing systems, but it's just kind of changes what the risk is and how big each of those individual risks are. So we have multiple contracts. Montana generally uses vendors to implement their systems. I know some states might build some things in-house, but it's breaking it up into something a little bit more manageable and then managing the risks around that versus having something that's so huge that if a risk occurs and becomes an issue, you may not be able to recover from it.
That's a really great one. Yes. All right. Yeah, that's super helpful, Jeralyn. Thank you so much. Are there any other whys around the system, Shelley, that you'd like to share? Or kind of why going modular or why moving away from one large system to smaller ones?
I really think that the benefit that modularity brings to us is that we are able to have more strategic successes in our implementations. Right. So, Jeralyn mentioned the premium billing and collections component that we implemented. Right. So it really does allow us to procure, this is the functionality, we need it here, we need it when, and we need it to do what. And so modularity, from my perspective, really does enable those targeted successes that really will build onto really retiring our old system. Our old system had 53 kind of components, right? So the MIS and then 53 little ancillary systems that all really were tightly coupled, right? They all had to work together. And this really allows us to plug and play in a lot more meaningful way so we can adjust more quickly.
That's great. So one of our core values at PK is impact, and we've built this podcast around it because it's really important to us. And for us, impact means that we approach every engagement with our energy focused on identifying the right goals, outcomes, and strategies, which often are not the ones that present at the beginning, and that we each have a kind of personal responsibility to make a positive impact on our projects, on our teams, on our communities. I'm curious, just personally for the two of you, what does impact mean? Like, how would you define it, and how is it important in your life or your work?
Oh, I do not have a prepared answer for this, so I'm just going to talk through it. I talked earlier just about community and taking care of other people, and I like to think that is the end result of the work that we do on the systems side, but we're really far removed from those people. So I like to think that we're here to serve the people that serve the people that serve the people. So I'm here to serve Shelley as she implements her system. She's here to support providers. She talked about having been a provider herself. And then those providers are really the ones there, hands-on, helping people, making that impact. So I like to think that, I am contributing to that, even though I don't always see it in the day-to-day.
Yeah. What's impact for you, Shelley?
It's actually the reason you get up and go every morning and do this job, right? Because it is extremely dynamic. It is definitely challenging. I never do the same thing, never, every day. It's always something different. And so impact, keeping in mind the folks we serve and how critical it is that we have the technology in place to support it, is absolutely what gets me up every morning and gets me going and happy about being where I am. And then it's really important. And Jeralyn, next time I'm gonna include you. So every year, at the end of the year, I try to do a recap of, hey, here's some notable things that we really did. And it isn't about, we implemented this system. It's always about, did you know that we enabled this neonate have services? We were able to quickly enroll this provider and get them transferred to the right hospital, the right facility. And guess what? They're back home and they're doing great. And so those are the stories I try and collect through the year and send them out to my team and say, just so you know, you're a part of this. And that's really what I think keeps us all going.
Yeah, that downstream impact of remembering why the day-to-day IT system can be challenging and stressful, but that downstream impact is so important. I love that. I think that's a really great tool to use.
Yeah, I think we see the numbers, like this many people are enrolled in this many programs and this many claims were paid, but it doesn't tell the story of what you're talking about, of like, what was that like for the person who really benefited from that and got the care that they needed. Yeah, it is important to share those stories.
And it's easy to forget why, even the system's there and the program's there and who it's serving and why. So it's a good reminder. What kind of impact do you guys personally want to have on the world? Do you have a plan and a focus, or where do you think that lies?
It's so funny. I think people who knew me as a younger person would really be confused as to where I ended up in my life. Because my mom still asks me when I'm going to go to law school. And I thought I'd run for public office or something, but that just wasn't where I ended up and where my passions led me. And I'm much more interested in the day-to-day of working with good people to do good work so that the citizens and the end users of these systems have a better experience. That is actually very meaningful to me. And I appreciate the ability to do that work.
I'll talk to your mom about the law school thing.
No, I know.
I didn't know that.
Do you know how many lawyers work for PK?
We're good. I love that. What about you, Shelley? What kind of impact do you want to have on this world?
I think I have a whole a work identity and a mom identity.
Yeah.
My work identity has always lended itself towards just really seeing people become successful in whatever definition that is. And so really at the end of the day, I hope to leave behind folks that are more stable. They had what they need, or they have what they need. And that truly, truly, honestly, I actually need it to continue to function in my life.
Yeah.
That is truly what motivates me, and I end up doing servantist type work regardless of what role I'm in.
Yeah. What about in your personal life or as a mother? What kind of impact do you want to have?
I think for my kids, I want to see them become whatever they're organically going to be, and I'm just sort of providing the bumpers, right, for what that needs to be. And really sharing what my values are, and really hoping that they also end up wanting to make people feel better, wanting to make people successful in whatever they do.
It's interesting because so many of our guests on the podcast actually have ended up talking about Scouts. Interestingly enough, I've talked about Scouts more than I thought. And also just about how the service that they have found in their careers is something that they want to instill in their children. which I obviously have that as well as a mother. So I love that that's where you went. Okay, well, back to the MPATH system. What kind of impact will that system have? Like, let's say it's done, it's complete, check, it's been successful. What's the impact of that system on Montana or anyone in Montana?
I think we kind of talked about it earlier, that ideally it will be that the right people have the right service at the right time, and then that is enabled in a way that isn't torturous to go through. And we talk about interoperability, and this is a focus we're really embarking upon, sort of this embracing interoperability and the whys. And when you think about, I work all day, and so when I have to go to the doctor or whatever, I don't want to have repeat tests. I just want it one time and then what?
Yes.
and so really it's even that, right, is making healthcare more concise, so that people can continue to live their lives and become more self-sufficient.
And what's the impact on the providers? I'm going to share a little bit about what that might be.
Yeah, I was just thinking about this for end users. I think it's really like a million little things. Some of them may just be that they get their claims paid a little bit faster, but a lot of it's just going to be usability of these systems. Some of them are going to be on mobile platforms. We're going to have improved reporting that's not going to take as much time. All sorts of I hope that they forget what it was like when we had the old system, and this just is what it should be. And it's not something they spend a lot of time worrying about or thinking about. They just know the system's going to be there, it's going to be easy to use, and it's going to do what it needs to do.
Do one of you want to talk a little bit about what interoperability is for those that don't live in the MES world every day?
So interoperability is really kind of two things, right? So CMS is really provided, this platform of we need states, we need healthcare, including us, right, CMS, to be able to be interoperable. So what that means is that we have technology in place that enables standardized communication between systems, so that, so many systems don't talk to each other.
Yeah.
So these systems are going to be able to talk to each other in very standard ways, and then present that data, present that information in a way that is meaningful for the end user. So at its really sort of is the easiest definition, that's what I would say interoperability is.
Yeah, and I always think of trying to take the data from, this doctor, this hospital, this, counselor, and how do you get that full view of the client, right? Or the patient that's in front of you as a doctor or as the next provider. Anything that you would add to that?
Yeah, I think data is really the next challenge after that. We've worked with some agencies in different states where they're just so excited, like, we're going to have so much data. And then they get the data and they're like, I don't know what to do with this data. And also data is just more challenging than you think it's going to be, where there's a program that uses one of the modules from MPATH that is not a Medicaid program. They actually do like early childhood and education services. So they have a different federal agency that oversees their program. And it's just the littlest things, like the way that one federal agency asks for race to be reported, race and ethnicity, is different than another. And so what do you do when these systems are trying to talk to each other and you just need to run a report that meets this federal standard? And so there's a million little decisions like that and little things that come up that just make it harder than you want it to be. So interoperability and data, I think, are two big things that we learn more about every day.
Well, and I think you hit on such a big issue, because you have interoperability in the healthcare world, but then we have lots of states and the feds that are trying to figure out interoperability at the health and human services level, right? So that we can have a full view of a child or a family, and that's kind of what you were getting at. And not just race, because I think we found in our other work, address, where you live, like even as something as simple as your address. And I'm like, why is this so hard? But you have, when you bring in not just multiple state agencies, but multiple federal partners that all have different requirements on how you present that data, it does get challenging. But I think the the flip side of that, like the impact of a state or a provider or someone being able to see the full view of a family or a child or an adult and kind of understand not just their healthcare, but also their living situation and, their education and, their child care and all of those pieces, if they're involved in the courts, I think is such an opportunity if you can use that data in a meaningful way.
Yeah, and I think, Shelley, outside of MPATH itself, there are some things that your agency is working on around, I can't think of what it's called. Is it maybe like social determinants of health?
So social determinants of health is right here. Yeah, and it does.
Yeah, it's everything.
Right. We actually successfully ran a pilot to identify folks based off of social determinants of health. And we looked at incarceration in Japan and where are our highest risks folks for being homeless. And if you don't have a home, it's really hard to even think about your own health care, right? So let's get back to the basics. So really the whole pilot was to say, we are able to identify folks who are homeless. We are absolutely likely to identify folks who are going to need emergency services versus, preventative type services and that kind of thing. And it just, the results of that were very intriguing. And we are looking to have like phase 2 of that pilot, but to obtain more incarceration data. We started with a small county in Montana. And we're looking to sort of expand that across the board so that we can really understand and then target energy folks who can help with placement and help finding housing and that kind of thing.
Housing, utilities, food, like jobs, voc rehab, like there's just so many connections there and it affects the health of an individual for sure.
And then thinking about, that is really daunting, right?
Yeah.
You look at what services might be available to you and you have no idea. And so the department is implementing a system that it's a resource engine, right? So when you come to the department, you are able to identify based on sort of using some AI technology, the system understanding a little bit about you, asking a few questions, and then being able to really send you to the right resources that you might need at the right time.
That's amazing. I think that so many of our clients are challenged right now with just identifying where the resources are in the community that are available because there are so many and trying to make those connections. So that's really exciting.
Do you find that's additionally difficult with rural populations that you're serving, getting them those services?
Absolutely. I think the rural nature of Montana and some of our other really close states by states, right? That is absolutely something that we are always, looking for ways to expand resources. And we actually have a community and faith-based resource now who works really across the state to identify, right? Because it isn't always about what Medicaid services are,
or even the state. Yeah.
But it's truly about what is out there for me. And so really having this resource, reach out and work with, faith-based organizations and that kind of thing, really expanding where there may not necessarily be a specific counselor or, a case manager.
I'm excited to see how that turns out. Okay, well, let's move on. Each quarter, our podcast has a different theme, and the theme this quarter is adaptability. And so adaptability is defined as the ability to adjust to different conditions or circumstances. So when you think of MPATH and adaptability, what do you think of? And what kind of emotions come up for you? Is that something that you've had to deal with?
I would say I personally have adapted in a very significant way. When I joined the team, I really was like, okay, here's what we're doing, here's when we're doing it, and here's how we're doing it. And obviously things have just changed, right? First, we needed to implement this module. And so It started with me and evolving my own mindset. And then being able to help the folks that I work with also share that mindset as well. But we're going to be course correcting for the next decade. So let's just strap in.
Get ready.
We have. And so I think with change always comes that fear of the unknown. I mean, when you think about it, right, going from I'm going to implement one system that's going to support Medicaid to now really, once we're done, there'll probably be about 13 or so systems. And so really try to make sure that we are able to sort of course correct, adjust, and recognize that the priority is right now, but the priority might be something different later on down the road. And we just need to sort of roll with that and make sure that my team is structured in a way that we have the ability to resource that as well.
That's a great point about making sure that not just the people and the individuals are ready, but that your structure is ready for that change. Jeralyn, tell us, what do you think about when you think about MPATH and adaptability?
Oh, it's been so much change over the years. It's the only constant, right? So within our role itself, we adapt as their plans change, and we've really been able to have good conversations about making sure we're meeting their needs in the best ways possible and giving them support in those specific areas where they need it. But also, the federal guidance for what our role has changed. I think this is the third iteration of that in this contract that we've been with. So it used to be a little bit more flexible as far as what IVNV did, and then the federal agency made it more specific. We do want you doing these things. We don't want you doing these things. And so we adapted our scope of work and our contract, did that, and then that has loosened a bit again. And it was a really great opportunity to look at our work and adjust it there. Because if we can't adapt, we're just going to be in the way of all the people that are adapting.
That's a really good point. So you talked about the federal guidance for IVNV changing. What other conditions or circumstances have you guys had to react to and adapt?
Well, there was a pandemic.
Oh, yeah, that COVID thing.
Shelley's team has moved their office multiple times. It's the day-to-day is always something different. You make a plan and then it has to adapt almost immediately, it seems.
Yeah, I would agree. Our team, not only is our team moved, and yes, the federal guidance for IVNV
and everything else,
but so it's that certification, right? We have a tiny team compared to other states trying to take on this work. Our team is actually quite small. And so we really had put in place tools and like templates and strategies to sort of just, really certification evolved for us. And we've really had to sort of adjust from this very structured thing that was, there was a lot. And I actually liked it, right? Because it was the foundation of some of our requirements to this outcome-based, which is really an important transition. But definitely it is a challenge. It's a huge challenge to resource those changes, really.
And you've also had some changes in how APDs, which are the advanced planning documents, which set the foundation for financing these projects. There's been a lot of changes in those over the years also.
Oh, absolutely. And we're in the process we had a consolidated APD for our modularity initiative. So we really had funding for all of our modules in that one APD. And now we've had to transition into very small structured APDs. And so deconstructing.
It's better. You modularized your APDs. I never thought about it that way.
And then, really how CMS needs our information and how they're structured, right? That is constantly evolving. So the questions you're answering beyond here's what we're requesting, here's what we've actually spent, those questions that you're answering for them, it has definitely evolved really in the last couple of years.
Yeah. So moving on, one of our aspirational values at PK is progress, which is really all about that collective impact, right, over time. And we want each project or each engagement to kind of build upon the last, so that we move from, one project view to how do we make a community, an agency, a project, and ultimately the kind of the world better than when we started. So is the MPATH project, you talked about this a little bit earlier, but I'm going to dig in a little bit. What project is it a continuation of, or is it continuation of other work?
So MPATH is truly kind of what evolved from our MMIS replacement project. It was really sort of a big bang MMIS, or Medicaid Management Information System replacement. And I mentioned this, it had 53 very sort of tightly coupled components. And so what we've really had to do is sort of look at our business processes, how those systems have supported them, and then find a very strategic way to pull our business processes out in a way that makes sense, orchestrate that information. Ultimately, MPATH is absolutely going to increase the usability and access, right, to healthcare ultimately. But the usability of the systems means we actually can be more efficient, more effective. And to me, the efficiency and how effective you are. And if I'm engaged with the system, used to take me an hour and a half to do something, but actually now it takes me 15 minutes to spend through that thing. And I get the same information and the same or better result because I have more information that I'm collecting. That to me is also progress.
That's great. Jeralyn, is the work that we're doing in the IVMV world, is that a continuation of other work? And how has that kind of work and methodology changed over your last 15 years?
Yeah, well, there's been a few people over the years that love to draw things out on whiteboards. We have one now, but the old CIO for the department did this as well. And so I'm thinking back, more than a decade when they had this vision for their integrated eligibility system that was going to have an enterprise service bus and a business rules engine and all these things that we didn't know what that was, but it was this vision, like this really visionary thing of how to bring together all these different systems, all this data throughout the agency. So it's actually kind of fun to know that a lot of those things exist now. This is not the project that was going to build them. This isn't exactly the way that they were planned, but we did get there. And so the vision of the agency has built upon itself to get to here.
So that progress has occurred over time, even though you've had to adapt and change and run and move.
I'm sorry, you can't get the full experience of watching someone very passionately draw this out with different colors of marker and, showing what the world could look like if we modernized the systems.
Okay, good. So I also think that progress for me is also about lessons learned, right? What do we learn from when things go well or when we fail? And oftentimes I think we learn a lot from when things don't go as planned. So do you have any lessons learned, either of you, that you can share that a listener could take from this project and potentially apply to their own and help us kind of move the needle and make even more progress over time? And again, lessons learned from things that went well or things that didn't go as planned. Anything that might be useful to the listeners.
I think, so lessons learned for us now, every time somebody has an ask that the system needs to support, we just know now, okay, we have to look at every single module and how this is impacted all the way down to our reporting. Previously, I think folks would reach out and system need, oh yeah, we can do that. And it just really was impactful in one place. And so really making sure up front, right? Because with each change that you have to orchestrate in the different modules, you really have to make sure that that's communicated. You give people the right time, the right amount of time to be able to support all of that. And so for me, it is about analyzing impact, what you believe that the impact will be, and you get better, right? As things go along, you sort of hone that skill a bit, but really analyzing what that impact is going to be across my entire enterprise, making sure that I have the right people in place to do that analysis and then work through the orchestration of it. I would say make sure that you have data people on your team. It's something we just were fortunate enough to have onboard those resources at the right time. But I know that without being able to look at that data and how it makes its way through your system, and just truly understanding what needs to be where, and when one system calls it one thing, another system calls it another thing, and literally the three other systems downstream call it something different each, right? And so being able to tie all of that information together is probably one of my best sort of lessons learned, right? We've gotten better at it. And it leads to, I think, smoother implementations of these projects. So,
Jeralyn, lessons learned?
Well, I was just thinking about how doing these modules, we actually get to apply our own lessons learned as we go. And there's lots of little ones along the way, like how long should testing be? How do we know how many sprints are going to be enough for this work to be completed? And so because we have these iterative projects, we're learning a lot as we go and applying it. So no one's going to be perfect their first time doing a system implementation. And that's something that states struggle with is a lot of people on these projects are program people, but they've maybe never implemented a system before or not like this. And they definitely haven't implemented 15 of them. So being there to watch the people learn and apply their own lessons learned has just been really interesting. And just think about how good we're going to be at this by the time we get to the end of the modules.
Yeah, I think back to, someone working in a Medicaid agency might see one large system implementation, two if they're lucky and they stuck around long enough, versus now how many you're dealing with and that churn and change. So any other lessons learned that you guys would share?
This is pretty Medicaid specific, but start your certification earlier than you think. Start getting ready earlier than you think. It's going to take longer to get your project started than you think. It's going to take longer to write your requirements than you think. So just being aware that things take time and you want to do them well.
They do. And I think that the resources to support certification, unfortunately, are the same resources that are also supporting user acceptance testing and all of the
happening. Yeah.
Right. And so really trying to make sure that you put the right supports around that certification process, as well as making sure that things run well.
All right. Well, we'll go ahead and close out. So to close out each of the podcasts, we're actually having our guests share their wisdom on our other two core values. So we have 3 core values. The one is impact, but our other 2 are inclusion and teamwork. So I'm just going to give you a minute. What I'm looking for is just your best advice for our audience, and this is just fun, so nothing hard, on achieving those other 2 core values. There's no wrong answers. So the first one is just for inclusion. So what is your best advice for achieving high levels of inclusion in the workplace?
Yeah, I think that's something I learned a lot about being more remote as the pandemic was happening, and building teams or even bringing on new team members in that virtual environment, which I've worked remotely for 15 years, but it was different. Everybody was just them and their computer. And how do you make people feel like they belong and that they're cared about? And so taking the time to just build those relationships, letting people know that you care about them and that you want to know and understand them. You're not just looking for them to plug away and do this thing and then leave. So for me, it's often just silly little discussions or asking people, how their weekend was, how their kids' recital was, and building that trust slowly by caring about them as people.
Great. Shelley?
So I would say to build inclusion, it's about collaboration and partnership, which is kind of about teamwork as well. But so each of my team members, right, when we onboard them and we put them in our team meeting the first time, everybody on the team meeting has to share like some just personal thing about themselves, some fun little quirky something or another, something, some event, whatever. And it starts there, right? Oh, okay. Now I know a little bit about you. I feel a little bit more comfortable, a little bit safer about sharing a little piece of me. And that really sort of builds on itself. And then you're right, we try and spend time with each other outside of work, and activities. And so that you really are invested in, you're important to me. The other thing I would say is crucial is to, make sure that you are adapting as a leader to people's life circumstances, right? So, yep, the rules are you're supposed to be here from 8 to 5. Yep, I get it. But, you know what? I have a family thing, and it's really important that you allow your staff, your team, to be able to support the things outside of your job, because then they're really willing to come support you back. Right. And so really understanding, being approachable to say, oh, I've got, my sister passed away and I'm going to need to take some time off. And I'm also getting custody of their kids. Right. So really understanding, okay, so what do we need to do? Work schedule, what needs to happen here? Do we need to ship things? And just recognizing that if you invest that time now, they're going to understand how valued you find them to be part of what it is we're doing.
And they're going to be that much more invested in you. Yeah. That was great advice, both of you. Okay, so switching to teamwork, what's your best advice for achieving high levels of teamwork in the workplace?
Well, something that does not come naturally to me is just letting people do their own thing and trusting that it's all going to be great. So I think as a leader, I've had to think about myself and allowing people to be a team instead of being just the people I assign things to. And I get better. I know I will get better stuff back from them if I give them that ownership and let them work together to improve the processes and improve the outcomes. It's just hard. So for me, I think about teamwork, about how I need to, like you said, adapt as a leader, how I need to sometimes get out of my own way to let that teamwork happen.
It's great. I also don't see that in you, so I'm interested to see how that shows.
We'll talk later.
Yeah, and I can't wait. Shelley?
For me, I think teamwork really starts with making sure that you understand you are part of a team and you're a partnership. So I also agree, Jeralyn, that you know what, as long as we get the same outcome or a good outcome, doesn't have to be my way. That is absolutely a kind of a core value. But from my perspective, partnering a new team member with an existing team member that has that expertise and really sort of allowing some mentorship and then being available for just any weird little question. I'm available, text, chat, email.
All the ways these days.
Exactly. Reach out to me and think about it as, if you can't ask me that question, then you can't be productive. And that's why we're all here. And so I would say, yep, let people execute things the way that they need to in order to have it make sense to them, as long as you're going to get the same outcome. But also make sure that they have at least 1, 2, or 3 folks that are key for them, that they are working with and really engaged with every day.
Yeah.
And collaborating.
Yeah, giving them that support, it sounds like.
Yeah. Mentoring.
Yes.
I just find it's probably my favorite thing in my job, because I got so much stuff in my brain, to be able to share that with someone else, and hopefully they take something from that and build upon it so that they don't have to learn things the hard way.
Yeah, I wish everyone saw how important that mentoring is. I know that you see it because I see it every day at you, but it is such an important piece of making sure that you also have support for yourself, right? So if something happens in your own life, then someone else can step in and figure out how to do it. So, okay, well, anything else that you guys feel like you want to say or want to share about the MPATH project that we didn't talk about today?
No, I would say that there is nothing one single leader can do to deliver without your team. And that team is not just your core team, but it's also the people you work with that are, supporting services, your vendors. So they're all part of a team. So if you can really sort of think of things in that broad of a perspective, I feel like we get a lot farther, a lot faster.
Anything else, Jeralyn, on your mind? No? Okay. Well, I can't thank you enough, both of you, for your time. What a privilege it's been to be here with you, to connect, to learn, to grow, to breathe, and to share. Until next time, this is Stacey signing off.